several outcomes that we are expecting from the head of state's meeting coming up. First of all, it will be the report of the COVID-19 situation will be presented by the chair of the union, His Excellency President Ramaphosa. And we also know that the Executive Council will be presenting to them a decision on financing of vaccines. I mean, and working very closely with the Afri-Exim Bank. I think that decision, we remain very optimistic that it will be addressed and supported so that we at least have a financing vehicle with a political backing to that. I have absolutely no doubt that there will be a strong discussion amongst head of state, a positive discussion on the need to continue to have a joint continental strategy to fight the second wave and distribute vaccines as much as possible.
Elizabeth Merab from The Nation in Kenya says, will countries need to follow the continental regulations? And what happens if a country, say Kenya, insists on assessing the safety and efficacy of the vaccine on its own? Is it free to do so?
Yeah, I think the answer is yes. I mean, countries are sovereign. We've put in a mechanism to streamline the process so that if a vaccine has been looked at and reviewed at a central level or regional level, say through the East African community or the Southern African community, development community, there should absolutely be no need to keep doing it country by country. It will just slow down the process. But if a country chooses to do that on their own account, that is also very, very appropriate. The key here is to do it right and do it quick.
All right, thank you. Paul Adepoju has come back. Perhaps we skipped over this one. And he says he'd like to know more about the update on addressing the oxygen shortage in several African countries.
Oh, yeah. I think, Paul, thank you for bringing back that question. I think Africa CDC is working with several partners, especially Total, to try to see how they can use their extensive presence in many African countries to supply oxygen. We've had a series of discussions directly with them and plan to have other discussions. Just yesterday, we received a response back from the French embassy here that we have approached them to use their networks to convene a meeting that we discuss further with the Total in Africa to facilitate that process. We are also in discussions with the World Bank just last week so that we can move in a coordinated way to supporting countries regarding access to COVID-19 needs for oxygen. So a lot of work is going in there because we know that will be, it continues to be a need or an area that requires a considerable effort to begin to reduce the mortality that we are seeing from this second wave.
Thank you for that. We have a question coming from Dr. Fred Molelekwa. And Dr. Fred says, good morning, Dr. John, and congratulations to the Africa CDC for its 4th anniversary. Globally, health workers have been praised for their bravery, their dedication and excellence in managing the COVID-19 pandemic. Now they are in the front line to receive the vaccine, which is highly commendable. However, I am of the view that it would be good if their immediate family members were also put in the first category of the people to be vaccinated to ensure complete state of health of these health workers. Can the Africa CDC use its influence to garner support and from individuals to support this idea by making pledges to buy the vaccines for the immediate families of the frontline workers?
That's a very good question or comment, Fred, and we are doing just that. I think this is a very good suggestion that personally I haven't thought of. The family, we were very focused on the healthcare workers. And as you recall, last week we indicated that the MTN had donated $25 million to enable us get vaccines for the healthcare workers. And we also are encouraging the private sector to join the efforts of MTN so that the efforts can be improved. So again, that is a very good suggestion. And quite frankly, I haven't thought about that, and we will factor that into our strategy going forward.
Thank you for that. Elizabeth Merab has come back with another question, and she says, and it is referring to the breakdown of the 16 countries that you mentioned that have put forward their requests for the vaccines. And her question is, which ones are they?
So, Elizabeth, unfortunately, I don't have the list of those countries in front of me. So I just want to be careful that I don't give you names of countries that are not accurate. So, but please be assured that next week we will be able to provide you with the names. And by then, I'm optimistic that the numbers would have increased, and including the number of orders there. So bear with me that I don't have it with me today.
All right, we have a question coming from Katarina Hohi with Bloomberg in Abidjan. What is your view on patent waivers related to COVID-19 vaccines? And would it improve African countries' access to vaccines at more affordable prices if more vaccines could be produced on the continent?
A succinct answer there will be yes. It will definitely help a lot. I think that is, and for more so because we truly don't know a lot about how long these vaccines will protect. I mean, in other words, would the vaccines be protecting for 1 year or 2 years or 3 years? I think that is important. If the vaccines are found to that they protect, but then the protection wanes after 1 year or 2 years, it means that we'll be in a repetitive mode to vaccinate over and over. And that will require that we have a continental production of vaccines. So I think that is a very good question. So we believe that intellectual property transfer, the entire discussion with the World Trade Organization, it becomes very valid at this point.
Thank you. Dr. Diana Nsubuga has this question. As we target health workers, how do we ensure that community health workers are also included on these lists?
So keep in mind that we are not just targeting community workers. I mean, that is a start, but nothing says that we have to do it sequentially. It all depends on availability of vaccines. I think the only reason that community health workers will come in front quickly is that they are the people out there fighting for and protecting us. So we need to protect them so that they can protect us. We also know that as the vaccine market opens up, it will be more a question of an aggressive vaccination exercise to reach our 60%. I mean, whatever formula we use. I think we know that people with underlying diseases should be prioritized. We know that people, the elderly, should be prioritized. We also, of course, recognize the vital importance of healthcare workers. However, we also want to protect our economies. Okay, for example, if there were vaccines in Ethiopia, I'll make a case for long-distance truck drivers to be vaccinated. The young people that run around and to make the economy work should be vaccinated, because these are the people that are infected, they are symptomatic, but they do transmit the virus. That is what makes COVID-19 prevention extremely difficult, because it is people who are infected and they are symptomatic. It means they become a reservoir, they keep transmitting. The reason that we were able to bring down SARS very quickly was that SARS, those who were infected with the SARS in 2002, they were only transmitting the virus when they were sick. So it became very easy to identify people who were sick, isolate them, and do stuff with them. But so from that, the pathogenesis and the clinical spectrum of SARS and comparing it to COVID-19, you realize that we need to have a different strategy of prevention, which says, how do we target the reservoir of people that are young, running around and trying to make life made and vaccinate them as well. So again, there's a whole framework of vaccination that countries will need to embrace to make sure that we scale up, not sequentially, but in a parallel process.
Thank you, John. Lawrence Caramel has come back with a follow-up to the question raised by Elizabeth earlier, and he says, how do you explain that only 16 countries have expressed their interest to get vaccines through the Africa CDC platform? Is it a matter of cost?
No, I think that is very good progress. In 2 weeks, if we have had that announcement since 2 weeks and 16 countries are on. And also keep in mind that countries that are getting, have placed all the requests through the COVAX mechanism, that is the WHO, Gavi, and CEPI mechanism. So we see this as a really good progress. It takes in-country dialogue to happen and the cabinet discussions to occur before they place their orders. We have sent them all the forms that are necessary and actually send reminders to all member states. So I remain optimistic. I will not characterize the 16 out of 55 as a low number in 2 weeks.
Thank you for that. We have 2 questions that are related coming from Silence Mugadzaweta from Newsday. And Silence says, herbal medicine and natural remedies have long been encouraged for use in many African countries. Is there any research that Africa CDC has done to evaluate their effectiveness? And is there scientific data justifying their effectiveness? This was one question, which had 2 parts to it. Then the second point that he's raising is, what is Africa CDC's position on herbal medicine and natural remedies as cure for COVID-19 complications?
We at Africa CDC are very supportive of any efforts that in the area of traditional medicine or remedy to treat COVID or other infections. We earlier on last year, if you recall, we had a joint meeting with the World Health Organization in Brazzaville to launch a task force that is working on, or a committee that is working on traditional medicine and remedies. So we are very open to that. I mean, we always say is 3 things: that all traditional medicines should have data that shows safety. Second, it has to show data that speaks to the efficacy. And thirdly, standardization. If we have those 3, and there's absolutely no reason why we shouldn't use that. I think we are very open to that. We ourselves are not out there investigating those drugs or those remedies, the traditional remedy. That is not what is our immediate need today or a priority today. But if a third party will say, well, we have a remedy here that we believe has an effect on COVID, we'll sit down and design a clinical trial, a protocol, and then work with WHO, AFRO, to make sure that the study is done appropriately. And of course, if the results are positive, we will use it or encourage countries to use it.
Thank you, John. Edwin Moyo has written in and he's asking, how many people on the continent do you expect to vaccinate and for how long?
We expect to vaccinate at least 60% of our population in 2 years in order to defeat this pandemic. We have to to be able to win the war against COVID-19, we have to vaccinate quick. And again, this is not something that the continent has done before. That is why we have set up what we call the African Vaccine Delivery Alliance, which is bringing in all kinds of partnerships that will work collaboratively in a coordinated manner to roll out the vaccines speedily. If we do the vaccination quick, then the issues of variants and others will no longer be an issue, because that means that the virus is, we've denied the virus the ability to transmit. So the short answer to your question is that our goal is to make sure that we vaccinate at least 35 to 40% of our population in 2021, and then in 22 we vaccinate the rest. And again, this will all depend on the efficacy of the vaccines that we are choosing. If we choose a vaccine that has a lower efficacy, then of course that rate, the proportion of people that will need to be vaccinated will definitely increase in order to achieve that community or herd immunity that we've all talked of.
Thank you for that. We have a question coming from Joshua Suleiman, and Joshua says the Nigerian Medical Association has suggested a trial before vaccination. How factual is this assertion? I guess we can also interpret it as saying how possible or how useful is this suggestion?
I would not, our position at Africa CDC is that if a vaccine has been tested and it has gone through the 3 phases, that is phase 1, phase 2, and 3, and that it has been pre-approved for emergency use at the World Health Organization or an authoritative agency or the Africa CDC mechanism, and we see absolutely no reason why a country would see a need to conduct another clinical trials of that vaccine to be used. The clinical trials are complex, they are expensive, and you don't do that in the middle of a pandemic like this. You use what works. I mean, I think that is very, very important that countries work with us very closely and not design new trials for things that are already working.
Okay, thank you very much, Dr. John. We are almost at the end of our allocated time. So I will give you the next few minutes to please round up and sum up the main key headline points that would be the main takeaways from this press briefing today.
No, thank you, Wayne. And of course, colleagues who are on this platform. My first message to all of us on this platform is that we know what works in preventing COVID, the spread of COVID. And we should work together to keep implementing those measures. If you look at countries like Kenya, Ethiopia, and others that have, Morocco, that have bent the curve of the second wave nicely, they are doing that with public health measures. And we backing them up with basic and standardized other control measures. And so I strongly we will encourage that we adhere to those, that vaccines are not a magic bullet today. It's not like, well, because 1 million doses of vaccines arrived South Africa on the 1st of February, we should relax, go home and not do what we know works. And the things that we know that work include continuous hand hygiene, deny the virus space to spread by not gathering in large numbers or even indoor gatherings with people that are not part of a family. You cannot assume that someone who jumped into the household is not infected. Continue to wear masks and wear it consistently. We have to be resilient. If we keep doing those things, then it will build into the vaccine availability and access, and that will give us, improve our chances of winning the battle against COVID-19. Second message is absolutely that countries should join the platform, express their interest. The vaccines are there. And without that broad commitment, it is difficult for us in working through the platform to negotiate for pricing with and even payment with the Afri-Exim Bank. So I think with a strong appeal there for member states to submit the expression of interest through the platform, and they have all the forms, or they just go into the amsp.africa and place their orders or express their intent to get the vaccines. Those would be the 2 key messages that I really want to leave this briefing today with.
Thank you very much. That was Dr. John, the Director of the Africa Centers for Disease Control and Prevention, giving us the general outlook on the COVID-19 situation, as well as taking your questions regarding that issue. He also spoke about the vaccination and the progress that is being made, but also reminded us that we are celebrating here at the African Union the 4th anniversary of the Africa CDC. So, colleagues, I want to thank you very much for having joined us for this press briefing, and also to encourage you as you do your stories to talk about that website that Dr. John mentioned, and that is amsp.africa. amsp.africa. Let's meet again on Thursday next week at the same time, which is 11 a.m. East African time. For now, bye-bye, and have a good week.
Thank you, Wayne, and have a good week.